Amazing story, Tony. A new National Geographic special is giving viewers fascinating new images of inside a mother's womb using 3D and 4D imagery. The program will follow the development of a fetus from conception to birth. Dr. Anna Levtoff of Thomas Jefferson University Hospital is here to tell us what new things viewers will see and learn about that journey. Welcome. Thanks for coming in. You know, as a parent, I've seen sonogram images of my children before they were born. What does this take us to? I take it this is a whole new level of imagery.
Bob, for the first time, instead of seeing a slice of a fetus, we're able to see the entire fetal face with its depth, surface recognition with incredible detail. Both parents can easily recognize what their fetus looks like, and this opens up tremendous opportunities for communication.
You know, we were just looking at a picture. Obviously, you see the reaction of the parents to this kind of thing. You're looking at a picture of that face. You can tell if this child inside the womb resembles your family.
Yes, it's a wonderful emotional experience, nothing like conventional ultrasound. Both the mother and the father get very, very involved, and I think this has tremendous potential for improved bonding and for perhaps influencing maternal and family behavior when you can easily relate to the fetus that's growing inside of the womb. I think that this will have an influence on emotional and other behavior.
Now, these pictures we're seeing are remarkable enough, and I'm a father of twins as well. I understand. I don't know if we've got the image or not, but the twin shots are particularly incredible.
They are, because you can actually see the fetuses interacting with one another and touching one another, so that by the time they're born, they've been playing with each other for 9 months.
And this is them right now. What are we seeing here? This is
You're seeing one fetus kicking, straightening out their legs. There's the back side of the fetus. And the other one is holding his or her ear.
Remarkable. And is this, I imagine, will have major implications for diagnosing birth defects, for example, before birth?
Yes. We already know that for examination of facial features and for diagnosis of skeletal abnormalities, 3D ultrasound has a very important role.
And in the special, there is also a surgery that's done prenatally.
Yes.
And this kind of imagery would assist the surgeons invaluably.
Well, by being able to provide more detailed about fetal anatomy, we're hoping this would assist in those cases where surgery is required.
Now, what's been the reaction of parents in your experience to this kind of imagery compared to 2D?
I can tell you that once parents experience a three-dimensional ultrasound examination, they don't want to have any other kind of examination. Now, keep in mind this is performed in conjunction with 2D. This does not take the place of 2D. But the fact that both physician and layperson can recognize what they're seeing brings the experience to an entire different level.
I mean, you can even see skin blemishes and that kind of detail in this.
Absolutely. And sometimes some of the detail is a little frightening to parents. Perhaps they're not used to how large the fetal head is earlier in pregnancy. So this will require some explanation.
Now, if I'm a parent and I want to see this, I want to have this done, I can't imagine it's available in every hospital and every doctor's office.
Currently, it's not yet widely available, but I foresee that in the next 5 to 10 years, this will become a routine part of the obstetrical ultrasound examination.
We're looking forward to that. Thank you very much, Dr. Anna Levtoff.
Thank you so much for your
Appreciate you for coming in. In the Womb airs Sunday night.